Hi everyone, Dr. Nemechek here. I want to talk about skin cancer and how it shouldn't be viewed as, for the majority of people, it's this nuisance problem. They'll cut it out, burn it out, done. It's actually a warning about other things yet to come. So first, there's three major types of skin cancer. We got squamous cell, basal cell, and melanoma. And the names come from where these are in the body. So you have this, here's your epidermis layer. This is the chunk of skin, okay? And the bottom layer is called the basement or basal membrane. So if you have basal cell carcinoma, it's cancer here, basal cell, from that bottom line there. The stuff above that, most of these cells are squamous epithelium, so those, if they're cancerous, are squamous cell carcinoma. And then melanoma is from the melanocytes that give us pigmentation, make our skin various tones of darkness. Okay, so that's where they all come from. Now, these cancers originate from the radiation that occurs when you live on planet Earth. And by the time you're 30, you already have on your sun-exposed surface, where you put your fingertip, that tiny little spot, you might have 1 to 4 mutations here, 1 to 4 mutations here, 1 to 4 mutations here, on the sun-exposed surfaces by the time you're 30, okay? Now, these are mutations. These aren't cancerous cells yet. They are kind of the potential trigger within the DNA has been damaged by the radiation. But this radiation is harmless unless something turns it on. Now, fortunately, the majority of these cells only live about 28 to 40 days. And they disappear by a process called apoptosis. Apoptosis is a fancy term for just how cells normally die. And the body, lots of the cells, the body will take them and break them down and reuse the spare parts, the nutrients and things that are inside those cells. So there's apoptosis. And so about 28 to 40 days, higher number when you're older. So we're getting mutations all the time from being on planet Earth, and we are shedding those mutations from being on planet Earth. So if you have a skin cancer and you're 55, that wasn't because you sunbathed a lot when you were 20, okay? Because you would have already gotten rid of all those precancerous mutations in there within 28 to 40 days. You would have got rid of those cells in your 20s, okay? It's the continual ongoing exposure that we have that sets us up. Now, chronic inflammation is what increases the risk of cancer. How does it do this? Of skin cancer. The apoptosis doesn't work well, so you don't get rid of these mutations as easily. They hang around longer. Okay? So you have this mutation in there, and it's in the off position. This mutation for cancer, that inflammation stress is the thing that, boom, turns it on. So that's where you go from this harmless mutation to now it's activated, and now that cell is cancerous, okay? The inflammation also impairs the immune system. So when the cell becomes cancerous, it looks different from other cells, and the immune system tries to attack it, and we believe in most cases will actually destroy it. But if you have a lot of inflammation, the immune system doesn't do that too well, okay? Now you've got a cancerous cell that's growing, the immune system isn't working too well, and the inflammation makes the cancer even more aggressive in that it grows faster and it's more invasive. It'll burrow through tissue more. And these principles apply to breast cancer, colon cancer, all sorts of cancers, okay? But here we're talking about skin cancer. And then when you're trying to treat a cancer, the inflammation can make your chemotherapy treatments not work as well. So inflammation is a big deal here. It's not really the sun exposure. That's not a big deal, because I've had mutations all over my sun-exposed surface of my body for, if you count from 20, for 45 years, and I've never had skin cancer. Why? I've been focused on keeping my inflammation down for decades. Okay? And so if I keep doing that, it shouldn't activate it. Now, you have a little skin cancer, they do a punch biopsy or whatever, they treat it, they're like, good, you're done. It's not over. Because the inflammation that started this mess in the first place is probably still there. And that same inflammation can trigger other cancers. It's responsible for breast, colon, lung, brain, uterine, bladder, a slew of 85% of all cancers are going to be triggered by the same mechanism. Okay? The same inflammation can cause strokes and heart attacks, cause diabetes, autoimmune disorders, Alzheimer's, Parkinson's, multiple sclerosis, chronic depression, ADD, ADHD, schizophrenia, psychosis, bipolar, maybe even personality disorders, stem cell failure. So now you got to get your hips and your knees replaced. So this little skin cancer you had taken off is a warning that you have chronic inflammation that is still churning away at your body. Okay? And so our protocol, the Nemechek Protocol, was designed to lower inflammation, but really with a focus of restoring neurological function. Okay? But it's very effective for lowering inflammation overall. And one of the things you got to do is you got to deal with the leaky gut. And so now this actually, you probably only need it for 10 days, twice a day for 10 days here. A little lower dose of the omegas, maybe 1,500, because we're talking about neurological inflammation. We're talking about outside of that, you need 2 tablespoons of extra virgin olive oil every day. If you're having several skin cancers, maybe 5 minutes of VNS a day. Just once a day is dramatic impact of reducing inflammation. And then because of this ever-present concern now we're developing about COVID, leaky gut from COVID, a tablespoon of glutamine twice a day for 6 weeks will fix that part of it. So getting into this will dramatically change your skin cancer risk. Just a little aside, I had a woman, this was a number of years ago, and she was having, like 10 to 15 skin cancers cut off of her a year. Just tons. We put her on the protocol, and within about 18 months, completely stopped. No more skin cancers. She still had the mutations. She was still out in the sun, but her body was now working normally. She didn't have inflammation. It wasn't turning them on. She probably had much better apoptosis. So these mutations that she was naturally occurring were being pushed on. And maybe if she developed a small cluster of cancer cells here or there, the immune system might have been effective enough to just clean that up, and she didn't even know it happened. All right? So the sun gives you a mutation for cancer. It doesn't cause the cancer. It's the inflammation that causes the cancer. And that same inflammation that's causing your skin cancer can kill you from a stroke or a heart attack or another more vicious kind of cancer. All right? You got to get on this. Reduce the inflammation. That's all for now. Everybody, have a great day.